Who needs intensive psychotherapy? It's a class of people whose problems won't get better with less intensive interventions. Or if they had less intensive interventions, it just prolongs the pain and doesn't resolve it. It's a person who could have depression or anxiety or psychosomatic problems or sexual problems or sleep problems or any number of kinds of problems, but they're usually chronic. They don't go away easily. They're usually based on psychological conflict. Development can be blocked. Certain capacities don't develop. There can be trauma, which is the commonest thing we see in patients who need intensive psychotherapy. The kinds of people in therapy that I've treated over the years, it's a full spectrum. Some of the stories are so awful you just can't sleep at night. I've had patients who've been viciously beaten by parents or caregivers, people who've been kidnapped, people who've had terrible disabling accidents. I've developed a kind of expertise in dealing with patients who had very good parents, but they lost them. Their parents died when they were very, very young. I've treated patients who've had psychosis and bipolar illness over the years, and people would say, well, isn't that a chemical imbalance? And there is a chemical imbalance in those, but it's traumatic to basically not be able to discern what's real and what isn't real. That's really traumatic. There are a lot of people who suffer terribly, who haven't had these dramatic traumas that are easy to describe, and suffering is suffering. And sometimes that psychotherapy is keeping that person from killing themselves or just from a life of desperate isolation and a total abyss. And so one of the things that's happening in these intensive forms of psychotherapy is we're sort of getting to the bottom of where development went awry, and we help it resume. And this always has to happen in the context of earned trust. You have to take time with the patient to earn their trust. And that doesn't happen overnight. People who don't understand psychotherapy like to say it's talk therapy and that it's just talk. But we've been doing psychotherapy for about 100 years now, and it's not just any old talk. Psychotherapy is working at a biological level. It's affecting biological systems, it's affecting chemicals. We now have studies, we have brain scan studies that show that it actually changes the wiring of the brain. So psychotherapy, particularly when we're dealing with trauma, what we can do is we can literally get the person to think about the trigger for their trauma, and that activates those brain circuits involved in that trauma. And then while they're activated, if we've created a safe environment for the patient, which is a lot of what we do as psychotherapists, they can actually rewire it. So a lot of traumas can be healed. Canadians made a covenant. When doctors were asked to join the public system, the promise was that we are going to ensure everybody, like most medical treatments where a person has a chronic illness, most middle-class people would be completely wiped out if they had to pay for their chronic care. When we look at the kinds of people in Ontario, for instance, who've been in intensive psychotherapy, what we find is 82% of them have already tried less intensive forms of therapy. People often say, psychotherapy, that's for the worried well, it's for people from Hollywood or, blabbing away about trivialities, and it's for the rich. Well, if the government cuts out intensive psychotherapy, it will be for the rich. In recent years, there's just been this incredible breakthrough, this discovery that the brain is neuroplastic. And neuroplasticity is that property of the brain that allows it to change its structure and its function in response to mental experience. And these new trauma psychotherapies, they're one of the greatest breakthroughs in modern medicine as far as I'm concerned. And the patients always say the same thing when you work all of that through. They say, I don't feel like it's happening now. I feel it's over. I can move on. It's like it was a really bad thing. I feel really badly for myself as that child who experienced that. But it's actually over.